NLN NEX online quiz. Question 1. Which weight in pounds is closest to 50 kilograms using 1 kilogram equals 2.2 pounds in this timed practice item? Option A, 110 pounds. Option B, 1,100 pounds. Option C, 22.73 pounds. Option D, 52.2 pounds. The correct answer is option. Multiply kilograms by 2.2, so 50 times 2.2 equals 110 pounds. The other choice is divide instead of multiply, add the conversion factor, or move the decimal one place too far. Question 2. During a quick NEX review of a score report item, which word is closest in meaning to relevant in a classroom review sentence? Option A, related. Option B, heavy. Option C, unrelated. Option D, ancient. The correct answer is option. Relevant means related, so that choice matches the meaning in context. Heavy means weighty, not related. Unrelated means not connected, not related. And ancient means very old, not related. Question 3. After checking the choices in a study plan item, which answer identifies the substance dissolved in a solution? Option A, precipitate. Option B, solvent. Option C, solute. Option D, catalyst. The correct answer is option. The solute is the material being dissolved. Precipitate is a solid that forms in solution, solvent does the dissolving, and catalyst speeds a reaction. Question 4. If a review checklist stem gives one clear clue, which statement gives the best main idea of this passage? A study found that students who practiced with timed sets felt more comfortable during the actual exam. Option A. The exam has no time pressure. Option B, timed practice can build exam familiarity. Option C, timed sets remove all content gaps. Option D, comfort never changes with practice. The correct answer is option. The passage connects timed practice with increased comfort. The exam has no time pressure, is not supported by the passage, timed sets remove all content gaps, is not supported by the passage, and comfort never changes with practice, is not supported by the passage. Question 5. When time is limited on a common mistake question, which critical thinking response best fits this situation? A patient says, "I feel better, so I stopped the medication early," in a health literacy passage. Option A, medication should always be stopped early. Option B, teaching is unrelated to medication use. Option C, the statement shows a need for clearer teaching about completing treatment. Option D, the patient fully understood the instructions. The correct answer is option. Stopping early can be unsafe depending on the medication and condition, so teaching is needed. Medication should always be stopped early, does not follow from the situation. Teaching is unrelated to medication use, does not follow from the situation. And the patient fully understood the instructions, does not follow from the situation. Question 6. Given the information in a calculator-free item, which number is 10% of 250? Option A, 240. Option B, 260. Option C, 250. Option D, 25. The correct answer is option. 10% means 10/100, so 250 times 10/100 equals 25. The other choices come from adding or subtracting the percent, moving the decimal incorrectly, or dividing in the wrong direction. Question 7. Suppose a similar patient chart item appears on test day. Which word is closest in meaning to sequence in a classroom review sentence? Option A, weight. Option B, order. Option C, texture. Option D, chaos. The correct answer is option. Sequence means order, so that choice matches the meaning in context. Weight means heaviness, not order. Texture means surface feel, not order. And chaos means disorder, not order. Question 8. While working through a timed lab results set, which answer identifies the transfer of heat through direct contact? Option A, evaporation. Option B, conduction. Option C, convection. Option D, radiation. The correct answer is option. Conduction transfers heat when particles collide through direct contact. Evaporation is liquid changing to gas. Convection moves heat through fluid circulation, and radiation transfers energy by waves. Question 9. Before choosing an answer in a health literacy item, which inference is best supported by the passage? A patient education sheet used short sentences, headings, and pictures. Option A. Headings reduce the value of information. Option B. Long paragraphs are best for patient teaching. Option C. Pictures make written instructions unnecessary. Option D. Clear formatting helps readers understand health information. The correct answer is option. The sheet is designed to improve readability and comprehension. Headings reduce the value of information, is not supported by the passage. Long paragraphs are best for patient teaching, is not supported by the passage, and pictures make written instructions unnecessary, is not supported by the passage. Question 10. A student sees this safety protocol idea on a NEX review. Which increase is shown from Monday 14 to Wednesday 22 in a simple practice chart? Option A 8. Option B 36. Option C 5. Option D 22. The correct answer is option. The increase is the final value minus the starting value, 2214 equals 8. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference. Question 11. One concept map practice problem tests this skill. Which probability describes drawing a red card from a set with 7 red and 5 blue cards? Option A 7/12. Option B 12/7. Option C 7/5. Option D 5/12. The correct answer is option. Probability is favorable outcomes divided by total outcomes, so the result is 7/12, simplified to 7/12. The other choices use blue cards, compare red to blue only, or invert the fraction. Question 12. Several choices look tempting in a hydration log item. Which word is closest in meaning to verify in a classroom review sentence? Option A, hide. Option B, confirm. Option C, doubt. Option D, borrow. The correct answer is option. Verify means confirm, so that choice matches the meaning in context. Hide means conceal, not confirm. Doubt means question, not confirm. And borrow means take temporarily, not confirm. Question 13. For this vital signs nursing entrance question, which answer identifies the repeating a study to see if results hold? Option A, bias. Option B, estimation. Option C, classification. Option D, replication. The correct answer is option. Replication checks whether results are reliable across repeated trials. Bias is a systematic error, estimation is an approximate calculation, and classification is grouping items. Question 14. In a short cell energy practice STEM, which inference is best supported by the passage? A volunteer program grew after former patients shared personal stories at orientation. Option A, personal stories can motivate people to participate. Option B, former patients stopped the program. Option C, orientation should never include stories. Option D, volunteer programs grow without communication. The correct answer is option. The passage shows participation increased after meaningful stories were shared. Former patients stopped the program, is not supported by the passage. Orientation should never include stories, is not supported by the passage. And volunteer programs grow without communication, is not supported by the passage. Question 15. Among the choices in a patient teaching item, which answer identifies the group that does not receive the experimental treatment? Option A, sample. Option B, experimental group. Option C, conclusion. Option D, control group. The correct answer is option. A control group provides a comparison for the treatment group. Sample is the participants or items studied, experimental group receives the treatment, and conclusion is the final interpretation. Question 16. Using the facts in a dosage label question, which milliliter amount equals 1.2 L? Option A, 12 ml. Option B, 120 ml. Option C, 12,000 ml. Option D 1200 ml. The correct answer is option 1 liter equals 1000 ml, so 1.2 times 1000 equals 1200 ml. The other choices use 10, 100, or 10,000 as the conversion factor, which shifts the decimal to the wrong place. Question 17. Based on the clue in an infection control item, which word is closest in meaning to adequate in a health article? Option A, sufficient. Option B, ancient. Option C, empty. Option D, hostile. The correct answer is option adequate means sufficient, so that choice matches the meaning in context. Ancient means very old, not enough. Empty means lacking contents, not enough. And hostile means unfriendly, not enough. Question 18. Consider this high-yield fall prevention concept. Which answer identifies the tiny vessel where nutrient and gas exchange occurs? Option A, capillary. Option B, trachea. Option C, vein. Option D, artery. The correct answer is option. Capillaries have thin walls that allow exchange with tissues. Trachea carries air, vein returns blood to the heart, and artery moves blood away from the heart. Question 19. Near the end of a nutrition note review session, which inference is best supported by the passage, a school added quiet study rooms, and students reported fewer distractions? Option A, quiet rooms increase noise. Option B, students no longer needed to study. Option C, reducing distractions can improve study conditions. Option D, distractions are always helpful. The correct answer is option. The result directly connects quiet rooms to fewer distractions. Quiet rooms increase noise, is not supported by the passage. Students no longer needed to study, is not supported by the passage. And distractions are always helpful, is not supported by the passage. Question 20. Across similar oxygen exchange nursing entrance questions, which critical thinking response best fits this situation? A conclusion says a new study method caused higher scores, but the groups were not randomly assigned. Option A. The conclusion may be too strong because another factor could explain the scores. Option B. Higher scores prove every student studied more. Option C. A random assignment is never useful. Option D. The conclusion should ignore group differences. The correct answer is option. Without random assignment, group differences may affect the result. Higher scores prove every student studied more, does not follow from the situation. Random assignment is never useful, does not follow from the situation. And the conclusion should ignore group differences, does not follow from the situation. Question 21. Since only one choice fits the study schedule clue, which sum equals 5/12 plus 1/2? Option A, 1/12. Option B, 5/2. Option C, 11/24. Option D, 11/12. The correct answer is option. The denominators are already the same, so add the numerators, 5 plus 6 equals 11, then simplify to 11/12. The other choices subtract the numerators, multiply parts of the fractions, or change the denominator unnecessarily. Question 22. From the information in a lab safety item, which word is closest in meaning to beneficial in a health article? Option A, harmful. Option B, ordinary. Option C, helpful. Option D, drowsy. The correct answer is option. Beneficial means helpful, so that choice matches the meaning in context. Harmful means damaging, not helpful. Ordinary means common, not helpful. And drowsy means sleepy, not helpful. Question 23. At a testing desk during a blood flow review, which answer identifies the organ that produces bile? Option A, kidney. Option B, gallbladder. Option C, liver. Option D, pancreas. The correct answer is option. The liver produces bile, which helps digest fats. Kidney filters blood, gallbladder stores bile, and pancreas secretes enzymes and hormones. Question 24. Inside a kidney function science or skills item, which inference is best supported by the passage? A report says infection rates fell after staff completed a hand hygiene refresher. Option A. The refresher removed all risk permanently. Option B, training may have improved compliance with hygiene practices. Option C, training increased infection rates. Option D, hand hygiene cannot affect infection. The correct answer is option. The sequence suggests training supported better hygiene behavior. The refresher removed all risk permanently, is not supported by the passage, training increased infection rates, is not supported by the passage, and hand hygiene cannot affect infection, is not supported by the passage. Question 25. Through careful reading of an immune response stem, which increase is shown from Monday 13 to Wednesday 23 in a simple practice chart? Option A, 36. Option B, 10. Option C, 23. Option D, 7. The correct answer is option. The increase is the final value minus the starting value, 2313 equals 10. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference.